Welcome to The Dot, the podcast that aims to bring you closer to the heart of healthcare. I'm your host, Josh Messersmith, with Jenna Smalley, and in each episode, we'll be diving deeper into the world of Wyandotte Memorial Hospital, exploring the incredible services we provide to our community. Join us as we connect with our dedicated medical professionals who work day in and day out to ensure our community's well-being. From doctors and nurses to specialists and therapists, we bring you insightful conversations that shed light on the outstanding care available at our local hospital. Today, we are especially excited to welcome back a familiar and insightful guest, Tiffany Pottkotter, a professional clinical counselor and psychiatric nurse practitioner. Tiffany's expertise spans diagnosing and treating mental and emotional disorders, providing therapy and medication management services. Tiffany has been a vital part of our conversations on mental health, sharing her expertise and compassionate perspective on some of the most important topics in mental health care today. We're honored to have her back, so let's get started. Grab a cup of coffee, sit back, and tune in as we embark on this journey to explore the world of Wyandotte Memorial Hospital.
Welcome to the show now. We're diving deep. Your health and the wellness in your hands to keep. Tips and tricks to know now. Stories that inspire. Living life with knowledge. Set your mind on fire. Tune into the dot. Health from head to toe. Together we'll unlock the secrets you should know.
Tiffany, thank you so much for coming back and being willing to do this again. We had great feedback and great interaction with the last time that you were on with Belinda. So we just want to kind of set the stage a little more into a new year, and kind of talk more about mental health, breaking down those stigmas and really continuing the conversation. So before this meeting that we're or this recording that we're doing today, we did a social media post, and we listed 5 or 6, Jenna, right?
I think it was just a generalized post about, offer some topics that you'd like to hear regarding anxiety and depression or mental health overall. And then people were able to comment like what they wanted. So we just picked, 3 topics that were the most.
Okay. So these are kind of the community is interested in this, and the base that we're interacting with wants to hear these things. So it's really nice that we're not just Jenna and I sitting in this room. I mean, before we started recording, I hashed out many of my issues that I have with you. So it's not just ones that we're passionate about; it's those ones that the community like to hear too. So we'll get right into it. When we're looking at recognizing and managing anxiety, stress, depression, how does somebody recognize when stress becomes a problem?
So we all have stress in our lives, and we like to categorize it as like situational stress or chronic stress. So situational stress is when you're going about life, everything seems fine, and then we encounter an obstacle. And 100% of us will have obstacles. I often like to compare it to like the game of life. You're just going about life, and then, gosh, you have a pipe break, or someone passes, or your car breaks down. Those types of things would be like situational stress. So it pops up. It interferes with your life for maybe a few days or a few weeks, and then you go back to normal. So normal would be like your baseline. So the stressor has passed. And then once the stressor has passed, you also go back to baseline. A chronic stressor, when that becomes more of an issue, is when we have long-term stressors such as like financial stressors or relationship stressors, things that are ongoing that have no end in sight. Or a chronic stressor could also be, let's say we have a situational stressor that popped up. Our car broke down, we bought a new car, and then for some reason we're not going back to baseline. We're like, man, my stressor has passed, but I still don't feel good. I feel like I'm still stuck where I was. And people will say, I don't understand that. I don't understand why I still feel this way if all my stress has passed. So we have to recognize that some stress gets carried over, even if the stressor is long gone.
So when you say, being able to recognize anxiety, stress, when is someone able to know the difference between anxiety and like normal worry? And when should someone seek help?
So that's a great question because a lot of people have anxiety and don't realize it's actually anxiety. So I brought along my book that I use to diagnose people, and this is specific clinical criteria that we go through to see if you meet criteria for an anxiety disorder. And keep in mind, when we say anxiety, there's lots of different types of anxiety. There's generalized anxiety disorder, which I will go over today. Also, under anxiety, we have agoraphobia, which means not wanting to leave your house. We have panic attacks, panic disorder. We have social anxiety disorder, where you just don't do well in social situations. We have people that present with specific phobias. So, anxiety is a general umbrella term. And then under the umbrella is all the different anxiety disorders. So, what I see the most is generalized anxiety disorder. So, clinical criteria is excessive anxiety and worry occurring more days than not for at least 6 months, which seems like a long time, but honestly, by the time people come in, it has been 6 months that they've been worrying because they worry about coming in. About a number of events or activities, and this could be work, school, finances, relationships, etc. The second criteria is the individual finds it difficult to control the worry. So there's a difference between worrying about something, which is normal, which we do, but also you have to have difficulty controlling the worry, which means your thoughts are racing, you're trying to turn it off, you can't turn it off, you're not sleeping. The next criteria is the anxiety and worry are associated with three or more of the following six symptoms. So some of the symptoms have to be present for more days than not the past 6 months. So the first one is restlessness, aka feeling keyed up or on edge. You're just always restless or on edge. Number two is being easily fatigued. So this is more so than usual, or you do simple tasks or go to work and you come home and you just feel like you don't want to do anything. You just crash on the couch. Number three, difficulty concentrating or just your mind going blank. So you start to initiate an activity and then you just stop and you're like, where was I at? I can't focus or attention. Number four is irritability. Number five is muscle tension. A lot of people don't think of this when they think of anxiety, but when I say, have you had aches or pains or just feel like you're always tense? Because when we're tense, we're always hunched shoulders, clenching our fists or feet. That is definitely a criteria. And also sleep disturbance. So this could be difficulty falling asleep, staying asleep, or just not good sleep, like restless sleep. The next criteria is it has to cause clinically significant distress or impairment. And impairment means it's interfering with your ability to do normal activities. So I say, are you functioning at work with your anxiety? Because a lot of us have high functioning anxiety where we can go to work and be fine, and anxiety is a good thing. But if we're not getting our work done, if we're late to work, not doing the job, then that's called interference. Social. So is this interfering with your social life? Are you saying no to people? Are you not going out? Are you going out and having panic attacks? Or other areas of functioning? Are you not able to watch your children? Are you not, is your relationship not going well because of your anxiety? The other criteria is you can't be on drugs or alcohol in order to meet this criteria, because we know if you're under the influence, it's going to cause anxiety. So you have to be free of drugs or alcohol. And then it's not better accounted for by another disorder. So that's clinical criteria for generalized anxiety. If you meet those criteria and it's been going on for 6 months, and keep in mind, you don't want to diagnose yourself as I'm reading this.
I'm sitting right here and I've already diagnosed myself. Uh, so when you're looking at those, is it you need to check every one of those boxes or a majority of those boxes? Or if you check one of them, do you have generalized anxiety?
So for the six criteria, I read like the restlessness, fatigue, you have to just have three or more, and it has to be impairment in your functioning. So if you're listening to this and you're thinking, gosh, I check all those boxes. I don't want you to just say I have generalized anxiety disorder. It's still good to go get a professional diagnosis, because we got to make sure there's nothing else going on that could be causing this. But it's definitely a prompt to say, I didn't know that was anxiety. A lot of people have these symptoms but don't realize, yeah, that's actually what anxiety is. It's that chronic worrying and racing thoughts and not able to turn your mind off.
Selfishly, I think that was one of the reasons that we also invited you back today, was so that I could get that diagnosis right here with everyone listening. Um, but so you kind of talked about being able to have, high functioning anxiety and still being able to go to work and still being able to live your life and it's not really it's taking a toll, but not so much of a toll in your life that you can't function.
Mm.
So how does that play into burnout? Because I think it's one of the buzzwords that you hear right now in the workplace is employee burnout. So how does high functioning anxiety and burnout kind of go hand in hand?
Yes. So, some anxiety is good. It's actually productive. We call it like eustress. Some people function really well by having a little bit of anxiety. And it's good to have some anxiety because if you got to give a presentation or do something, anxiety is going to make you be prepared and be ready to go. So, burnout is when, keep in mind, just think of interfering or impairment with your ability to do things, normal activities of daily living. So, when you're burnout, you have dread. So, you don't want to get up and go to work in the morning. When you're here, you don't have initiation or motivation to get your tasks done. You are clock watching until the time that you leave. You don't have enjoyment or pleasure anymore out of your job. That would be like work burnout, or you're constantly looking for other jobs. That would be a sign of burnout as well, or just not feeling satisfied anymore, feeling like you lost your sense of purpose. You could be burnout from parenting, like you just lose motivation to cook or bathe your kids or take them to activities or go to their activities. You could have burnout from a relationship where you're just not putting much effort into it anymore. So when it starts to interfere with your ability to do that job or that task, that's when we know it's burnout because you're not completing your task anymore.
So can you come back from burnout? So is what does the process look like? Is it, I think I do everything in my life to the extreme. So when I'm burnout, I'm like, I'm done. And it's time for a major life change.
Yeah.
So is there a way to come back from that? So is it if you're feeling burnout, what are some ways that you can start to scale back to get back to a mindset to where you're not as anxious about work?
So when people come to me with burnout, I do like a full assessment on let's look at everything that's on your plate. And we literally draw like a circle, like a plate, like a pie chart, and
Mhm.
say, let's look at all these things. And then I assign percentages. If your burnout is 80% of your job, then I take job and narrow it down and say, is it your coworkers? Is it your workload? Is it your hours? Is it your pay? Like what actually is contributing to your burnout? Sometimes the solution, if it's job related, is to find a new job. We do have to constantly reevaluate our life and say, is this job, the position, the environment, the pay, the hours, is this currently working for where I'm at in my life? If the answer is no, then burnout's not going to leave because you still have the same responsibilities outside of your job. But if there's things that they're not doing, like if they're saying yes to everything and not setting good boundaries, or not sleeping well, not eating well, not taking breaks during the day, I say, okay, like if you love your job and you want to stay at your job, we have to do things differently. We have to make sure you're taking regular breaks throughout the day. We have to make sure that you're eating and drinking well and staying hydrated, that you have good connections with your coworkers, that you have good boundaries. You're being assertive with your boss and saying, this is too much, or I feel like this is the work of two people, like you have to, if they're lacking a skill that's leading to the burnout, then I focus on the skill set. But sometimes it is a matter of it's just not maybe the right job anymore or the right time in their life, and it's time to move on and find something else.
I think sometimes that's probably one of the hardest things to come to terms with, is that
Mhm.
it's time to move on or it's time to make a change. I think change is sometimes difficult and it's sometimes scary. But if it's for the betterment of, your mental health and your experience there and really, I mean, your coworkers' experience too. If it's betterment for that, sometimes it's what has to happen.
Yeah, change is hard, but it's an opportunity for growth. I have a lot of people that come from generations where you work the same job your whole life, and it's looked down upon or frowned upon to switch jobs.
Mhm.
That is not our culture and society today. We encourage people to reevaluate their job because we know environments change, people change, coworkers change, job descriptions change. And so our lives are changing too. You know, you might have a sudden family member that has a terminal illness, and that job you have is no longer driving with what your responsibilities are at home. So that's why we say we always have to reevaluate every couple months where we're at in life, and is this still working for me, or do I need to make a change?
So I think the next, talking about burnout and anxiety, the role of therapy and the importance of support systems, kind of like breaking the stigma of why is therapy for everyone, even if you don't have a mental health diagnosis.
So, gosh, I think the world would be a better place if everyone was in therapy. I do because we are not always great self-reflectors. We don't always have great insight, and so it's hard to solve problems by yourself. It's hard sometimes to even just go to your family or friends about problems because you need a completely objective opinion and you need someone to give you raw feedback that's not going to sugarcoat it, but that's going to point things out to you that maybe someone else wouldn't point out to you. So, everyone can benefit from therapy. You don't necessarily have to have a mental health condition. If you're sitting here listening to this and saying, well, I don't meet criteria for anxiety, I don't meet it for depression, life is good, um, that's fine. But let's say you just want to come in and work on assertiveness, or you want to work on boundary setting, or you want to enhance the relationship with your partner. There's so many other things we can address in therapy without having an underlying mental health condition, sometimes just family dynamics. We have people come in and say, I don't have the best relationship with my kid. How can I work on that? Okay, well, let's talk about why the relationship is bad. And um no, there's so many opportunities for growth and therapy, and it shouldn't be a scary thing.
So can you tell me, I mean, it's selfish here again because I
Mhm.
don't, I don't know the difference necessarily. So can you explain the difference between therapists, counselors, psychiatrists, and then peer support too?
Yes. So I know this is very confusing for a lot of people. So therapists, psychotherapists, counselors, social workers, it's kind of under the same umbrella. We all have different certifications. So therapists go to school, and at the end of the schooling, they have LPCC, which is licensed professional clinical counselor. Social workers will be LASWs, which licensed independent social workers. Um, Same similar training, we can all do counseling skills. So, if it's just a therapist or social worker alone, they can do, therapy or counseling with you. People also hear the word psychotherapy, it's kind of under the same umbrella. Psychiatrist, or psychiatric nurse practitioners, same umbrella. We do the same thing, different training. Our role is diagnose and management of mental disorders, but also we do the medication management. So the therapists and counselors do not do the medication. The psychiatrists and psychiatric nurse practitioners will prescribe the medications for anxiety, depression, etc. There's also psychologists. We don't have a psychologist here, but we refer to them. So psychologists, you can have school psychologists, you can have psychologists that will just do ADHD testing for us, autism testing, those types of things. There's developmental psychologists. So if you're not sure what you need, we do screen for that when you call. My nurse will ask you a bunch of questions and say, are you looking for just counseling? Are you looking for medication? Then sometimes the patients will say, I don't know. I don't know if I need meds. I don't know if I just
Yeah.
need counseling. So when you come in, we will just do a full assessment and we will make recommendations. So I might recommend a medication, but if you are not ready for meds or don't want to take meds, that's fine. We'll just do counseling or therapy. Our other psychiatric nurse practitioner is also trained in counseling. She doesn't have a counseling like license, but her education and experience also allows her to do counseling as well. So it just depends what you're looking for, but we are willing and able to offer both.
So you talked a little bit about it, medication. So when do you know that medication is the right path forward, or if you have those patients that are not as receptive of taking maybe some type of medication, how do you help them get on, kind of on board with knowing that that's going to help them in the long run?
That's a great question. There's a lot of stigma surrounding medication, unfortunately, and I usually say if you've tried counseling and you've really put 110% effort into it, then you are still having underlying symptoms. There's certain things that counseling just can't help. And you've tried all the theories, methods, techniques, and it's not getting you better, then probably there's a deficiency. And so when we have our racing thoughts and we can't turn them off and we're not sleeping, we've tried all these things such as meditation and mindfulness and deep breathing and it's still not working, then perhaps there is a chemical deficiency. So, medication is food. It's food for our body, so we need food to function every day. It gives us sugar. We need sugar, we need water. We need those things to feel good. If we're not eating and we're not drinking, then our bodies don't feel good. So, the same with, like, diabetics. If they, need insulin, they feel a lot better if they have insulin and they need to survive. So, psychiatry is just looking at another organ of the body. We're just looking at your brain. But sometimes the brain doesn't function, just like the heart doesn't function properly. Sometimes the pancreas doesn't function, and we have to address that organ. It's just there's such a stigma around the brain of like, oh gosh, what's wrong with me? Or I don't want to be reliant on a medication. It's not reliant. It's just we need that. And some people are just born with chemical deficiencies and that's genetic. We know depression, anxiety, bipolar is passed on to generations, and some people develop it as a result of trauma. So the brain responds to trauma. So if you've had something go on in your life, sometimes that brain goes into like that, fight, flight, or freeze mode where it says, you know what, I'm done. I'm checked out. I'm not making any more serotonin today. And it's like I compare it to like a thermostat, like if your brain functions well at 70 and all of a sudden you have trauma, it might drop down to 60. It's supposed to go back to baseline at some point. After the trauma passed, you should go back up to 70. You start producing serotonin and feel better. Sometimes the brain just says, I'm done. I'm overloaded. I have too much stuff going on. And so they come in here and say, I've been feeling this way for weeks. And I said, let's restart your thermostat. Like, let's try to get it from 60 back up to 70. And then we give you some medication. And then they're like, yes, I'm starting to feel normal again. Like, good, because your brain's starting to work again. And some people will be on medication for a few months and I'll taper them off and they'll do fine. And some people, require the medication for longer periods.
No,
Mm.
I think it's in general sometimes too that it is the idea of not just for mental health, taking some type of medication. I think it's across the board. I know I have high blood pressure. So one of the things that I take every day is a high blood pressure pill. At the beginning, I was very adamant that I don't need it. I can control it myself. Like I live a healthy lifestyle. I work out. I do these different things, and it just wasn't cutting it. And finally, my primary care said, like you can probably try as much and as often as you would like, but
Mhm.
you're never going to get below stroke level. So let's get you down with some type of medication. And so and we went through multiple pills or medications to figure out which one worked best for me, and was able to manage my blood pressure. So I think it is just a stigma behind medication in general, and then you throw in the stigma on mental health.
Yeah.
So then it's like, oh, I have a mental health illness, and now I also need a medication.
Yeah.
Like, oh my gosh, it's even more. So I can't imagine um, that. But thank you so much for explaining it.
Yeah. You did mention mindfulness and how it is so important. How can mindfulness help manage stress and improve focus in someone's, busy world?
So, I'll first describe what mindfulness is. It's basically learning to live in the present and paying complete attention and being aware to yourself and everything around you in the present because we are such a forward focused society, right? We're always thinking of goals and what do I need to do the next hour, the next day, that we often lose sight of what's in front of us that's perfect and beautiful, and we get caught up of just thinking, forward. So mindfulness can look like different things for different people. So the first exercise I usually have people do is when they leave my office, I said, I want you to practice mindfulness. I want you to tap into all five senses when you leave. So when you drive home, I want you to put down your window and pay attention to all the sounds that you hear, like birds chirping, or other cars going by. I want you to feel the breeze on your face. I want you to see if you can smell anything in the air that smells good, like the fresh flowers. And that's really, I mean, how often do we just get in our car and go home? And we're just thinking about what we have to do when we get home. We're just decompressing, but we're not actually taking time to be present in the moment of being in the car and, enjoying all the beauty around us.
I'm already a distracted driver, and now you want me to also smell the flowers, wind on
Maybe,
my
Josh,
face.
right? Maybe you should keep your window rolled up. Yeah. But that's one thing of just being aware. Another thing is meditation. Meditation can look vastly different for different people. I usually have people download apps like the Calm app or go to YouTube and just type in meditation, and you'll have thousands of videos that pop up. Some are people talking to you, some are just music, some of it is guided imagery where you're envisioning what the day, you want the day to look like. Mindfulness can be body scanning of just if you're feeling hurried or something, just say, I'm going to do a quick body scan from head to toe. And you're like, man, I'm really tense. I'm clenching, I'm deep breathing. I just feel really tense. I should probably take a moment and decompress. Mindfulness can just be learning how to deep breathe and learning how to calm your body by breathing properly. And it's also just, being self-aware of your thoughts and being okay with your thoughts. So, we talk to ourselves all day long, right? We just have a constant internal dialogue, and that can be really good or really bad. So, it's being aware of your thoughts and being okay with your thoughts. So, if you have, um, negative thoughts such as, "Gosh, I'm doing a terrible job," or something, it's allowing that negative thought to be there, not judging yourself, and just being like, "Yeah, I had a negative thought. I'm gonna work on filtering that, and I'm gonna fix it." So, it's just really learning to be present in the moment and being completely aware of all your senses.
Do you think, like mindfulness, I guess, how can practicing something like mindfulness kind of rewire your brain for positivity and positive thoughts?
That's a good question. So, basically, we can change the power of our thoughts by creating like new neural connections. So, I often use the analogy to my patients of you have a pathway going from A to B, A to B. And let's say you're just a constant chronic negative thinker. So something happens and you think the worst case scenario. That's what your neurotransmitters are used to following that path. So every time we can catch a thought and say, instead of A to B, I'm going to go from A to C. And C is my new positive thought. Every time we do that, we're wearing out the old path and we're creating a new path. So then our automatic thought process is positive, but we have to be able to catch our thoughts and know what our distortions are, know what our negative thoughts are, so that we can create new, neuron pathways. And when we do that, we're then naturally releasing dopamine and serotonin, which then makes us feel better about ourselves. So your internal dialogue is so important all day long, and a lot of people don't realize, the brain is something you can rewire, and it just takes practice, but, you're perfectly capable of rewiring your own brain and your own thought process. So, if we're able to do this, it also helps us regulate our stress hormones, and it just aids in, like, our cognitive restructuring day to day.
So you kind of talked about it earlier a little bit, the role of sleep, diet, exercise. Again, personally attacked for all of that. But can you talk about how lifestyle choices truly, really do influence the emotional well-being and mental wellness?
Yeah, so I think we can all agree if we don't sleep well, we are not functioning well the next day. We might be more anxious, more irritable with people, more stressed. And so we know regular and proper sleep hygiene is like your baseline for mental health. The other thing is, I always ask people like, well, how much caffeine do you drink a day? What's your day look like from breakfast, lunch, and dinner?
I'm sitting over here self-reflecting as I'm like 2 hours of sleep last night, an energy drink this morning, coffee. Like
Yes.
I understand it.
Yeah.
Again, this is I'm so glad that we're doing this because it is a personal therapy session for myself.
Yeah, I mean, caffeine alone is not a bad thing, and some caffeine is good and functional and helps with energy, focus, and attention. But if we're drinking too much caffeine, there is a strong link clinically between caffeine and anxiety. So that ramps us up, increases our blood pressure and our heart
All of it. Like
rate.
you're describing my entire life this whole episode. So
So I really encourage my patients to start like limiting caffeine intake, cutting yourself off at a certain time, especially if there's sleep issues. Me personally, I just can't do caffeine. I even if I had like I had a fourth of a cup of Pepsi for the Super Bowl, and I was up all night. So some people are just more sensitive than others. But I ask, like how much sugar are you eating per day? Are you eating a bunch of carbs? Where's your protein at? All those things go into our energy level. If we're eating processed foods all day, we're gonna be, foggy brain. We're not gonna have like sharp focus attention. So I really try to clean up the eating and drinking and say like, how much water are you drinking? I mean, we need to be drinking what 60 to 80 ounces a day, and most people don't do that. So, um, when people do start making an effort to make lifestyle changes of proper sleep hygiene, drinking their water, eating fruits and vegetables, they actually do start to feel better. But it's hard because those are big lifestyle changes. So you just do little things at a time to slowly start to change.
so before we go, can you talk a little bit about some small habits that people can do that are going to have a big impact?
Sure. So I would say the first thing I'll talk about small habit with sleep. Just turn off electronics an hour before you want to go to sleep. We're all guilty of it. We all scroll before we go to bed and then just put our phone down and try to go to sleep, but our minds are activated, it sees the blue light and it's ready to roll. So maybe just turning off your phone or putting it in a place where you can't easily reach to it, before bed. Going to bed at the same time every night and trying to get up at the same time every morning, regardless of how you slept the night before. Still try to get up at the same time and establish a good routine. Another thing I would say is water intake. If you know you should be drinking 60 to 80 ounces a day, you get something to fill it 60 to 80 ounces and you drink it all day long. But personally, I can talk about I recently found out I had high cholesterol, and I pretty much had to change the whole way I was eating. And so I said, okay, for breakfast every morning, instead of my bowl of Cheerios or honeycombs, like I substituted it for a huge bowl of fruit every day with granola, and that was just like one small change. I thought, well, that's I can manage that, I can do that. And then like this week I incorporate when I come home, I do like a cup of vegetables because I wasn't like a big vegetable person. So it wasn't like I came home and I immediately was like I had to change everything. It was like I gotta gradually work myself into this. Caffeine reduction. If you're drinking 3 coffees a day, just try 2 coffees a day and see how that goes for a little bit. And then try to limit yourself to 1 coffee a day. If you're eating, like, junk, for snacks, or maybe you're skipping lunch and just eating, like, chips or something, then just say, "Okay, instead of chips, I'm gonna eat a healthier snack," or, "I'm just gonna be mindful and intentional. I'll eat something little every 2 hours." You have to make your goals achievable. Otherwise, you're just gonna feel defeated, and it's gonna make you not wanna make any changes at all.
So that was all I think the questions that we had. But Tiffany, is there anything that you wanted to talk about that we didn't get to?
I think, my lifetime goal is just breaking the stigma.
Mhm.
Just advocating for people to take care of their mental health. If we're not taking care of ourselves, then we can't take care of other people. So, whatever stigma is in your way or obstacle, it's just time to let that go. That's very old school way of thinking that we can't talk about our mental health. Just so many people get helped by sharing your story, and I just feel so much power when people share their stories and come and get help, and then they refer their friend or relative, and you see generations of people just getting better. So, if you're listening to this and you feel like you still haven't taken that step to make a change, it's time to let that go. Just, come in and talk, and let's see how we can help you.
I love that. Thank you so much for doing this again, dealing with our questions that we have that are sometimes off the wall. But truly, I believe that, and we're seeing it in this community. From the feedback that we received from the first mental health podcast that we did, we're seeing people are starting to embrace it and starting to hopefully break down that stigma and normalize the mental health experience here. So
Good.
thank you for coming on. Thank you for making a difference for our community and all the patients that you see. And I'm sure this won't be the last time that we have another one of these conversations. I do know that after this, I probably should schedule my own appointment. So we'll probably see each other before the next podcast. But thank you so much, and we really appreciate it.
Yeah, thanks for having me.
We hope you enjoyed our conversation with Tiffany Pottkotter from Wind Up Memorial. Her dedication to psychiatry and compassionate approach underscores the exceptional mental health services available at Wind Up Memorial. Remember, mental health is just as important as physical health, and seeking support is a positive step forward. If you or somebody you know could benefit from psychiatric care or support, don't hesitate to reach out to the professionals at Wind Up Memorial Hospital. Thank you for joining us today, and we look forward to bringing you more stories and insights from the incredible team of medical providers in future episodes. Until next time, stay healthy, stay informed, and take care of each other.
The secrets you should know.